The Centers for Medicaid and Medicare Services set guidelines for coding the level of medical office visits, and this determines the level of payment for the service. The first guidelines were in 1995. The second update was in 1997. The third update was implemented in January 2021. These guidelines are used by most private insurance companies as well. Some of the main changes are as follows. The elements of history and physical exam no longer determine the coding level, but should still be medically appropriate for the level. The level may be based on either medical decision-making or time. Medical decision-making was simplified. Time was expanded to include total time on date of service, not just face-to-face time. The steps to determine the visit code are as follows. Determine if a new patient has not been seen in last 3 years in office, or an established patient. Calculate the time spent on the visit and its level code. Calculate the medical decision-making level. Choose the time or medical decision-making level which is more accurate for the work done. Medical decision-making has 3 elements. The number of and complexity of problems addressed. The amount and/or complexity of data reviewed. The risk of complications and/or morbidity and mortality of patient management. 2 out of 3 elements are used. There are 4 levels of care: straightforward, low, moderate, and high. In element 1, the lowest level is straightforward. This is when there is one self-limited or minor problem. The next is low, where there are either 2 or more self-limited or minor problems, 1 stable chronic condition, or 1 acute, uncomplicated illness or injury. Next is moderate. Here there may be 1 or more chronic illness with exacerbation, progression or side effects of treatment, or 2 or more stable chronic illnesses, or 1 undiagnosed new problem with uncertain diagnosis, or 1 acute illness with systemic symptoms, or 1 acute complicated injury. Next is the high level. This is where there are 1 or more chronic illnesses with severe exacerbation, progression or side effects of treatment, or if there is 1 acute illness or injury that poses a threat to life or bodily function. The second element is the amount and complexity of data reviewed. Straightforward level is where there is minimal or no data. Next is a low level. Here at least 1 of 2 categories is needed. Category 1. Any combination of 2 from the following. Review of external notes. Review results of each test, or order each test. Category 2. Assessment requiring an independent historian, such as getting the history from the parent of a young child. For the moderate level, at least 1 of 3 categories is needed. Category 1. Any combination of 3 from the following. Review of external notes. Review results of each test. Order each test. Use an independent historian. Category 2 is the independent interpretation of tests which were done by someone else. Category 3. This is the discussion of management or test with an external physician. For the high level, at least 2 of 3 categories is needed. Category 1. Any combination of 3 from the following. Review of external notes. Review results of each test. Order each test. Use an independent historian. Category 2 is the independent interpretation of tests which were done by someone else. Category 3. This is the discussion of management or test with an external physician. The third element is risk of complications and/or morbidity and mortality of patient management. Risk is the probability and/or consequences of an event. This is not defined but is based on the common opinions of health providers in that specialty.
Morbidity is a state of illness or functional impairment that may be of significant duration during which function is limited, quality of life is impaired, or there is organ damage.
The lowest level is straightforward. This is minimal risk. This is treated with fluids, rest, diaper ointment, topical antibiotic to superficial wound. Next is low level, which has a low risk and treated with OTC medication, or therapy like speech therapy.
Moderate level has a moderate risk.
It is treated with prescription medication or decisions about minor or elective surgery made. It is also where management is significantly limited by social determinants of health. The high level has a high risk of morbidity and/or mortality. Examples are drug therapy needing intensive monitoring, decisions about hospitalization, decisions about major or emergency surgery. Time can be used to code for visit level without using the MDM elements. This includes all the time both face-to-face and other time spent on patient assessment on that day. This may be review of old notes or labs before visit, time of patient encounter, time writing notes after visit, or calling for labs or other information. All this can be added up to get the total. The time durations are different for new or established patients. The MDM code levels correspond to CPT codes created by the American Medical Association. They have much more information on their website, including a free grid that can be downloaded and printed. It is a great reference and makes it easy to determine the coding level. In this example, there is one minor problem. The data is in category 2 with history from the mother, so is low. The risk is minimal.
Looking at MDM elements, there are 2 at minimal level and 1 at low level, so this will be a straightforward level 99212 for established patient. In this example, there is one acute uncomplicated illness, so problem element is low. The data element is category 2, using a historian, so level low. The risk is moderate since prescribing medication. The MDM has 2 low elements and 1 moderate, so level is low or 99213. In this example, the problem is one chronic condition with exacerbation, so level is moderate. The data is category 2 with independent historian, so is low level. The risk is moderate due to drug prescription. The MDM elements are 2 moderate and 1 is low, so is moderate level code or 99214. In this example, the problems are 2 stable chronic conditions, so the level is moderate. The data is in category 2, independent historian, so low level. The risk is moderate with prescription drug management. The MDM elements are 2 moderate and 1 low, so is a moderate level visit 99214.